Today, a potential temporary setback in the fight against COVID as fears of a fourth wave become reality in some places. At least 41 states are asking providers to temporarily stop administering the Johnson & Johnson one-shot vaccine, following a recommendation by the FDA and CDC this morning, quote, out of an abundance of caution. Experts will now examine potential safety issues after 6 women under the age of 50 developed an extremely rare blood clot within weeks of receiving that vaccine. One of them died and another was hospitalized. The vaccine was approved for emergency use by the FDA in February and has since been used to effectively protect nearly 7 million U.S. adults from COVID. The Biden administration says this will not have a significant impact on their vaccination efforts and stress the importance to skeptical Americans that the other available vaccines are still safe. Watch.
The bottom line is the vaccines, Moderna and Pfizer, that are now being administered are clearly safe and are saving lives, and every American should get vaccinated when it's their turn.
There have been no red flags. When you have a red flag of something that is as serious as thrombocytopenia, particularly when you have an individual, one of whom died, you take that seriously.
Joining our conversation, MSNBC medical contributor Dr. Kavita Patel, a former health policy director in the Obama White House. Donna and Jason are still here. Dr. Patel, I spoke to a senior White House official who said that they were prepared for some challenge in this rush to vaccinate Americans and to beat these variants. And that is why they purchased so much supply of all of them, frankly, but especially of Pfizer and Moderna. How do you evaluate this news today on J&J?
Yeah, I think it's really, hopefully I can just give people some solace in what you said. It's rare, extremely rare, and I can talk about all the other types of adverse effects, side effects, and things that we see in other vaccines. I'm not dismissing the person that died, the families that are dealing with it. They are incredibly affected by it. But you can't vaccinate billions of people and have zero side effects, adverse events, or risk. I think the key here is that the FDA, while many are criticizing it and saying that they were overly aggressive, the FDA is doing what the FDA is supposed to do, look for safety signals. I think the decision to pause has been confusing, and I hope that by tomorrow afternoon, when the CDC Advisory Committee is scheduled to discuss and vote on what this means, we will get clarity. But as you heard, I think this was the right thing to do. And I would ask the question, what's the alternative? How many of these cases of clots on the heels of what we're seeing with AstraZeneca across the world would we wait for? And it would, either way, Nicole, it feeds into vaccine kind of myths and misinformation. So I think our job today and going forward is to fight it and to reinforce to people these are safe, these are effective, and we still have people dying from COVID, and these vaccines prevent death.
Well, that was my next question, and you got there ahead of me. It seems that to people listening to Dr. Fauci and yourself, we're going to hear that in context, right? But to the disinformation echo chamber that is doing a lot of harm with communities that are reluctant or hesitant, do you fear this fuels that anxiety among those populations?
Oh, absolutely. This is, I describe this and I feel this. It's been a long time since I felt really depressed. And today, listening, watching the press conferences, I was depressed because it's a gut blow to the world's vaccination effort. These are really good vaccines. I would say that about AstraZeneca, too, that the risks are far less. The benefits outweigh the risks. And I'm watching countries, entire countries, family members who have died in India and Pakistan, and they would give anything to have a chance at one of these shots. And Nicole, I was just on the phone with our clinics. We are looking at possibly throwing out doses if people don't want this vaccine. And at the same time, I've got 20-year-olds in the hospital. So I think that this is a gut blow. And I think it reinforces something we've talked about, that we have had so much misinformation, such a lack of credibility in the science. Anybody who is concerned or curious, we'll be watching tomorrow as the CDC is covering this, and we want to bring those conversations transparently to light. And that's the most important thing we can do. If anything we've learned through January 6th and everything that's happened this past year, we need more of these conversations to be public and to look at the facts. And that's exactly what we're going to do. And that means the fact is, if you're not vaccinated, you are that much more likely to be susceptible to getting COVID, and you have a much higher risk of having all of these bad events.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.